Welcome everyone. My name's Leanne Humphreys and today I'm talking with my colleague Dr. John Cooper. John's a psychiatrist who has extensive experience in the management of issues relating to post-traumatic mental health and has been involved here at Phoenix in the policy and service development, training and education and research domains. Hi John, how are you?
I'm well, thank you, Leanne.
That's good. Today we're going to be talking about the management of pre-existing mental health disorders following the experience of disaster and trauma. And John, we know that for a proportion of the population who experience disaster, a percentage of those individuals will have pre-existing mental health conditions. So my first question is, do these pre-existing conditions confer a vulnerability to the development of trauma-related mental health disorders?
Yes, Leanne, we know that prominent amongst the pre-trauma risk factors for developing post-traumatic mental health problems is a history of previous mental health disorder. In understanding the presenting problems a person might bring to us as clinicians in the post-disaster setting, it's really important to obtain a history of the nature of any pre-existing mental health problems and the status of those problems at the time of the trauma or disaster. And I guess what we're talking about here is a potential broad range of pre-existing mental health conditions, from the more serious mental health illnesses. I'm just going to backtrack a little bit there. The range of pre-existing mental health conditions extends from serious mental illnesses such as schizophrenia, major mood disorders and the more severe personality disorders, through to some of the high prevalence disorders like mild or moderate depression, anxiety disorders and post-traumatic stress disorder. But we also include consideration of vulnerable personalities and developmental disorders. So these pre-existing conditions at the time of the disaster may have been in remission, or they may have been presenting with stable and well-controlled symptoms, not particularly impacting on function, or the disaster may have occurred at a time where the person had active and ongoing symptoms. It's therefore really important for the clinician to determine whether they are dealing with a relapse or an exacerbation of a pre-existing condition, or whether we're dealing with a new condition that has arisen as a result of the disaster. Given our task as clinicians is to provide effective advice and treatment that will reduce symptoms and associated risk and also to improve functioning, we'll do that a lot better with more success if our interventions are well matched to the presenting problems. We're better able to do this when we've taken a thorough history and performed a mental state examination that can then inform an accurate formulation. From that formulation, our treatment plans will logically follow.
Okay, so that response starts to lean into the issue of how best to approach the situation, and in particular what's standing out for me is an emphasis on the importance of formulating in guiding treatment planning. So why is formulation so important?
Well, for me, I think the formulation is the pivot to what we actually do in clinical practice. It's the link between our assessment, including reassessments, and then the therapy, treatment or management we provide to our patients. The psychiatric formulation has been said to be the clinician's compass guiding our treatments. And when I'm thinking about formulation, I'm looking at a systematic way of answering three main questions. What happened? Why did it happen? And what can be done about it? And how do we proceed? And I think a case formulation brings together all information gathered during the assessment in order to develop a full picture of these presenting problems. I think in terms of approaches to formulation, there are different approaches. I like to keep it simple, and I tend to think through the method of the 4 Ps. It's a fairly basic but useful approach that considers the presentation in terms of predisposing factors, precipitating factors, perpetuating factors, and possible protective factors, things that might be a strength that we can tap into. Obviously, there are more sophisticated approaches, but I like to keep it fairly simple. So in the context of this discussion, the pre-existing mental health conditions that a person might have are clearly a predisposing or a vulnerability factor. And I think understanding that is a key plank in our formulation. It helps us understand the presenting problems that we might see in the post-disaster setting. So obviously the disaster event and its sequelae will be the precipitating factor. It might be the actual event and the related trauma, but we know in post-disaster situations there are other relevant factors such as grief, loss of housing, financial stress, and so forth. A relapse or an exacerbation of a pre-existing condition might also act to perpetuate mental health problems. And if we don't think about them, or if we miss them in our assessment, they're less likely to receive appropriate targeted treatment, and the absence of that treatment could perpetuate ongoing problems. And so I think it's also important to obtain a history of mental health conditions that have responded well to treatment in the past. And they may be formulated as a protective factor. It could give us as clinicians a strong basis to be optimistic about recovery, that the patient has had a positive experience of treatment, that we can elicit from that history information about their treatment response. It also helps when we know that our patients are comfortable and familiar with treatment pathways. I think these factors can reduce the likelihood of there being delay in a person presenting and accessing treatment. And I think when we can reduce those delays, we improve their prognosis.
Absolutely. Okay, thanks very much, John. So in summary, basically we're saying that pre-existing mental health conditions certainly do confer a vulnerability for the development of post-traumatic mental health conditions, and that we should approach the situation with an awareness that highlights the importance of conducting thorough assessment, being really clear about diagnosis, and in particular focusing on formulation in particular as we're considering treatment planning. Thanks very much, John.